Well, it's a product that holds promise to relieve some of the complications of diabetic ulcers. We'll introduce you to the man behind the new therapy cream after the break.
Working for you in the spirit of Arkansas, this is Channel 7 News Midday.
Welcome back. Well, Omnibalm Daily Foot Therapy, a cream for general and diabetic foot care, has been developed at the University of Arkansas for Medical Sciences, and it holds promise as a treatment for preventing the reoccurrence of lower extremity ulcers in diabetic patients. Dr. Bill Gurley, a UAMS College of Pharmacy professor, developed Omnibalm, and he joins us now with some details about this product.
Thank you for having me, Erin.
Yeah, of course. Thanks for being here. So tell us a little bit about what this is and what makes it different from any other cream.
Sure. Well, Omnibalm Daily Foot Therapy has been around in the Arkansas area for almost 10 years now. And it started off as I actually developed the product over 25 years ago to prevent or to help with some really severe sunburns. And so after that, because of some of the unique ingredients in it, it's effective for a wide variety of skin ailments, if it burns or itching, and a wide variety of other things. And so a lot of people started using it for various reasons, and a lot of diabetics started using it. And we started getting a lot of good feedback from diabetics about it helping with their foot issues. And so with that anecdotal evidence being fairly compelling, we developed we got a pilot study to look at its effectiveness in preventing the recurrence of diabetic foot ulcers.
Okay.
And so the study recently finished, and it was an interesting study because we basically the way the study was designed was we looked at the usual care for preventing diabetic foot ulcers, which oftentimes is just to use what's known as diabetic footwear, which are special shoes to help take pressure off the feet, because diabetics get a lot of pressure ulcers, and that's what these basically are. And so that was one that was a control group, and then the treatment group was to use the diabetic footwear in conjunction with applying Omnibalm on a daily basis. And what was really interesting is we followed the subjects. They had all the patients had a recovering foot ulcer that had healed, and they were taking digital photographs, and they were evaluated by a dermatologist and a wound care specialist, and then they were followed for 6 months. And at the end of the 6 months, almost half of the people that only got the usual care developed a recurrent ulcer, but none of the people with usual care plus the Omnibalm got an ulcer. So it was pretty compelling evidence. Yes.
So what is it that's in this that makes it so different?
Well, it's a unique combination of moisturizers and really high quality tea tree oil. And tea tree oil is a unique oil that comes from a tree in Australia, and and it has a wide variety of medicinal properties. It has antibacterial, antifungal, and anti-inflammatory properties. But it also has skin permeation enhancement properties. So it pulls a lot of these other unique emollients and stuff into the skin. So it's a unique product. There's nothing else like it out there on the market. And
so is this going to be something that is useful for people who don't have diabetic foot ulcers? You mentioned sunburn.
I actually use it on my feet every day.
Yeah.
It prevents you from getting any kind of athlete's foot or things. I mean, my son's college baseball team uses it, so it keeps your, if for nothing else, it keeps your shoes smelling good too. I mean, it's pretty phenomenal stuff.
That's a neat product. Okay, so tell us how we can get this.
Yeah, so it's available at most Walmart Supercenter pharmacies in the diabetic section, up on the upper level. If you do the economics of it, it only takes a small amount, about a bead, the length of your finger is enough to take care of to each foot. And that tube will last you about 6 to 8 weeks. So for a diabetic, about 20 cents a day.
And how much does it cost?
About $11.80. Yes,
that's doable.
20 cents a day is about what it comes out to be.
Very good, and developed right here in Arkansas by Dr. Gurley. Well, thanks so much for bringing this and showing it to us and developing it.
Well, thank you very much for letting us kind of help folks about the recent results.
Absolutely.